Back. In this segment, we visited Omega Hospital, where we talked to a patient who has battled breast cancer for many years. Her story and her courage truly inspired me, and I know it will inspire you as well. Take a look.
My patient was referred to me by a university physician out in the West Coast, and she was referred to me specifically for the type of procedures that we do here at Omega and that I do in my practice both in New York City and in Charleston, South Carolina.
I was diagnosed with cancer in 2004, and at that time I just took the advice of my local doctors in my hometown, and I was considering at that time whether to have a lumpectomy or a mastectomy, and I went to a plastic surgeon before my surgery in my hometown, and he told me that I had no option for reconstruction because I was too thin.
We are now doing a procedure called the posterior artery perforator flap, or the PAP flap. The PAP flap is basically a new breast reconstruction technique that takes tissue and skin from the back of a woman's thigh and creates and resculpt breasts for them to look whole again.
Normally they do the reconstruction from the abdomen, and I didn't have enough fat in that part of my body, so that led me, because I didn't want to have an implant, that led me to choose a lumpectomy. So really it was that plastic surgeon that guided my choice, and now I realize, looking back, that was really the wrong choice, because there are options for reconstruction, which I have since found out. And because they think it's likely that I will reoccur because of the kind of cancer that I had the most aggressive kind of cancer. I have decided to do a double mastectomy with reconstruction with tissue from the back of my thighs.
I like this particular flap because it actually allows the shape of this flap to be coned into a beautiful breast, a very natural breast. The breast itself has a tonic shape to it, or like a teardrop shape to it. And this particular area where we remove the tissue, the skin and the tissue actually folds into a beautifully nice teardrop shape. So the women aesthetically are very happy with their outcomes. And functionally, they've had their breast cancer removed.
When my oncologist, I became 5 years cancer-free, but my oncologist was concerned that I was going to reoccur. And he was really urging me to have some kind of reconstruction. And he sent me to a new plastic surgeon in my hometown and said, talk to this woman. And she said, there are these options, but I don't do them because you need a team to do them, and I'm going to refer you to Stanford. So I went to Stanford and I talked to them at Stanford, and it didn't feel right to me, and I asked the people at Stanford for another referral, and they referred me to Dr. LoTempio. I flew to New York City, and that's where I found what I was going to do.
My team includes Dr. Robert Allen today, and he's the one that originated the PAP flap for the breast reconstruction technique. The perforator artery flap has been around for other various reconstructions, mostly for extremity reconstruction, but this is the first time it's actually being used for breast reconstruction.
They do a double mastectomy, and what they actually do is they scoop the breast tissue out of the breast so that you still have your skin, and they're going to keep my nipples for me, which is great, and then they're going to take enough fat from the back of my thighs and my inner thighs to reconstruct the breast with my own tissue. They actually hook up the blood vessels so that it's living tissue, and then I get a thigh lift out of it, which for a 58-year-old woman is a very nice thing. So.
The postoperative course is very similar to several breast reconstructive techniques that we've done in the past. They're in the hospital 3 to 4 days, and they leave with minimal pain And their activity level is extraordinarily high when they leave the hospital. They're able to walk around, go shopping, go out to dinner, and really resume most of their normal functional daily activities. So it is a advantage for these patients to have this type of surgery with a faster recovery rate.
I think you really do have to find the place where almost intuitively, almost in your gut, you know it's right for you. And one thing that happens to women when they get diagnosed with cancer is you have this feeling like you've got to have surgery tomorrow, you've got to do something fast, you're scared, and you really don't. You really don't. You really have time. I actually first felt my lump in April and didn't have surgery till July. And you have time to consider your options. And I just encourage women to look beyond their hometowns, beyond their doctor, and also it was very interesting. I think this is important. When I was 5 years cancer-free, my oncologist said to me, "You are my model patient." And I said, "Why is that?" And he said, "Because most people, when they have cancer, they come to me and they hang their head, and when I say to them, 'These are your options,' they hang their head and they say, 'Well, whatever you think, doc.' And they don't take responsibility for their own healing." And then he said, when there's a bad side effect from what I chose, they want to know, what did you do to me? I always took responsibility for my healing. I created my path, and that's what women need to do, because you can find the right thing for you.
Get out there, get on the internet, read about the different techniques, but most importantly, look at the surgeon and the team. The team is really the utmost important. We have a team here at Omega Hospital. We have a bunch of surgeons that just purely does breast reconstructive techniques. This is what we know, this is what we do, and this is what I would advise women out there. Go to somebody that knows how to do this. Don't go to a team that does this maybe once, twice a year, or a month even. Go to somebody that does this every week, that knows the ins and outs, because then truly you'll be in the best hands if potential complications do arise.